Why do you have bloody nasal mucus? Medical science backed. Hi there. Welcome to MMAS Health. Bloody nasal mucus may sound scary, but it is usually not due to serious problems. The issue becomes a cause of concern if it recurs frequently, as it may indicate an underlying condition. Let us look into the causes in detail with some medical backing. 1. Dry air and low humidity. Bloody nasal mucus is often due to exposure to dry air over an extended period. The nasal passages are lined with a mucosal membrane that needs moisture to remain in good health. When humidity drops considerably and remains that way for long periods, such as in cold weather, air conditioning, and desert-like environments, these nasal tissues dry and crack open. According to a study published in the American Journal of Rhinology and Allergy, low humidity causes an increase in nasal dryness and bleeding risk, Patel et al. 2018. Therefore, the use of a humidifier, drinking lots of fluids, and saline nasal sprays will keep the nasal passages moist and help prevent bleeding caused by dryness. 2. Nose blowing and nose picking. Excessive blowing or picking creates enough trauma to the nasal mucosa. A bloody nasal mucus will be formed as a result. The nasal mucosa are rich with minute blood vessels, which may be ruptured by the act of blowing. Nose picking, or rhinotelexomania, repeatedly weakens a nasal lining with chronic irritation. Recommended gentle nose blowing. Avoid finger use inside the nostrils, and use soft tissues or paper on the outside of the nose during any bouts of sniffles. Jefferson et al. 2020. Irrigate with saline if mucus remains and congestion persists. 3. Sinus infections and allergies. Nasal infections and allergic reactions may result in bloody mucus owing to inflammation and irritation of the lining in the nasal cavity. During the inflammatory response to either viruses, bacteria, or allergens, the body releases substances known as histamines that cause swelling, congestion, and excessive mucus production. The inflamed tissue becomes frail and easily bleeds. According to research published in the Journal of Allergy and Clinical Immunology, chronic sinusitis and allergic rhinitis significantly increase the fragility of the nasal mucosa, Singh et al. 2019. It would help to treat allergies using antihistamines and nasal corticosteroids and help replace body fluids to prevent excessive irritation leading to bleeding. 4. Nasal irritants, smoke and chemicals. Exposure to cigarette smoke, pollution, and strong chemicals can injure the lining of the nasal cavity, giving rise to bloody mucus. Tobacco smoke contains toxins that dry up and inflame the nasal mucosa, making it crack and bleed. A study reported in the Chest Journal demonstrated that long-standing cigarette smoke exposure increases nasal dryness and vascular fragility. Rodriguez et al. 2017. Other nasal irritants such as fumes from paints and household cleaners or from strong perfumes can also sensitize nasal inflammation. Preventive measures such as not smoking, using air purifiers, filling the environment with humidity, and wearing masks whenever pollutants enter the equation will help in the upkeep of nasal health. 5. Medical conditions. Certain medical conditions can affect nasal blood vessel fragility, such as high blood pressure, hypertension, bleeding disorders, and autoimmune disorders. Hypertension acts to increase pressure in the vessel wall capillaries, and thus spontaneous bleeding occurs. Research outlined in the European Journal of Internal Medicine found that patients with hypertension are prone to the condition of nasal bleeding, attributed to fragility of the vessels. Andrade et al. 2021. Blood disorders such as hemophilia or thrombocytopathies will affect clotting mechanisms, thus leading to frequent nosebleeds. If the bloody mucus persists for some time, it becomes imperative to contact a physician in order to rule out other systemic conditions and obtain treatment. Closing words. Bloody nasal mucus is generally innocent, but discerning the underlying cause is indispensable not to allow it to recur. In other words, if you can keep your nasal passages moist, avoid irritants, and treat infections promptly, good health of your nasal passage will continue, and future bleeding can be avoided. Have you had bloody nasal mucus? Comment below and tell us. And don't forget to like and subscribe to get health tips.